Good morning. It is Friday, February 2nd, and this is the Board of Supervisors work session with the Environmental Health Department. I am Supervisor Lisa Heddens here with Supervisor Linda Merkin, Supervisor Latifa Faisal, Director of External Operations Sandra King, County Auditor Lucy Martin, Assistant Auditor Lisa Markley, Communications Assistant Bryce Garman. I'll let you two introduce yourselves, and then we've been starting with revenues
Okay, thank you.
first.
I'm Kimberly Grandinetti, and I'm the Director for Environmental Health, and I have Allie Hoffman with us, and she's our Administrative Assistant. We're going to start with the revenues. I had the right one up to begin with. Did you want to just kind of go through line by line on these, or did you just kind of, a lot of it's the kind of the same from year to year? Are for the well testing and abandonment, the first one, we're getting the same amount as expected for the fiscal year 25 that we received in 24. Our other, like our pumper grant contract that we have, that should be about the same. We don't have any additional land application sites or pumpers, so we should be close to the same as what we've had in the past. So, and I kind of went a little, probably about 2,300, because I'm not sure what it's all based on what his land application rate is and stuff like that, where we see a little difference. So I just kind of went a little bit more on the conservative side there. Our septic permits and everything, not too much change. It's kind of just been an average number of what we see going in. I kind of looked at like some of the site reviews that we do as far as like for the soil evaluations that the county is actually still participating in, and kind of updated those figures some. And so that's kind of how we came up with that number of the 14,400. The water well permits should be about the same for fiscal year 25. It'll be the 2,250. We're kind of standard on what we see on wells. The re-estimated value we have it at 2,600. That actually will probably be closer to 4,500. We just had, since I submitted this, we had a project that went on in the past that we didn't get permits for, and we're told about it. So we've just recently been working with the city of Ames, and they've sent us, we're working to retroactively permit some of those. So we just had a large check come through. So that's why we're going to see a little bit more this year. And then let's see, other health fees, which is our radon kits, that'll be about the same. We tend to, sell maybe about between 40 and 50 of those a year. And then our aquatic stuff that's for our inspections. That's kind of what we bring in for the pool inspections that we do. We do Story County, but we also have Boone County contract as well. So we will see probably close to about $13,000 in revenue for that. And then for our tanning, we have divided these out. So if you kind of notice that we may not have those going back, we have separated these out since last year. And so with tanning, we looked at, like, we have 15 facilities, and it's a standard fee of $33 per bed is kind of what we get. And so that's how we kind of come up with the $1,300 for their fees that we get. And then for tattoo, we have 10 establishments, and we do those for Boone County as well, so that the 10 is for Story County and for Boone. And so we should see about, for our inspections, about 2,500 for that. The change that we're seeing this year in revenue for fiscal year 25 is going to be the septic grant. That was the Story County Housing Trust. We ended up not so we re-estimated that figure to be about 30,000 for fiscal year 24. We ended up not getting as many applicants. And we've had about 5 applicants, but only 2 of them were actually, one is actually about to be approved. So we've had one that was approved and installed, and then one that's about to be approved, and that won't get installed until spring and stuff like that. So we are looking at, instead of doing the 75, we had $150,000 grant for the 2 years. They're going to do it on a yearly rotation. Now we're going to apply for a smaller one that would be a little bit more feasible for us based on what we're seeing. That'll be based on people applying if they have the need and things like that. We'll still do, we'll be able to do some promotion. We mostly just worked with some of our installers and stuff on different things. But now with Ally and stuff and the way that we're able to be focusing on some different things, we'll be able to do a little bit more, but I'll probably see about the same amount, maybe 2 systems would be able to, 2 to 3 systems and some repairs is probably what we'd see. So that's kind of, so we're seeing the 30,000 for the re-estimated and then 45,000 is what we're gonna apply for, and then we'll know for sure if we get it. I think it's in April. I think is that when we're supposed to get notified? So,
And you'll see the offsetting expense. There, it's a.
yeah,
grant.
it's offset into the expenses as well when we do that. Any questions on the revenues? All right.
Sorry. We'll go ahead to your expenditures, but let's talk about the position after we go through your budgetary area.
Okay, so we'll do just the operational cost.
Yeah.
Sounds good to me. And so, let's see, as far as our expenses go, tried to keep things as close to the same or reduce where we can. We kind of just gonna highlight some of the things, the vehicle maintenance, and fuels. We had put in, what did we trying to read here? We put in about 1390 for fiscal year 25. We'll probably see it, I'm guessing with the new vehicle now that, and when the oil changes, we had factored that in. Well, that is now, we have the plan that was approved, where we just take it to the dealership and we don't pay. So that could actually decrease to about 1,200 if we wanted to.
Okay.
I think that would be probably more accurate.
So for the reestimate or next year,
For next year, for fiscal year 25.
could we go up one line? The Board of Health?
Board of Health, sorry, if we did not, everything is the same on that one. And that one basically just includes their, they had voted a couple years ago that they wanted to have some training money for Board of Health members in there. And so that's what we're seeing. And then obviously we had some, like the new member this year, so we have like some signage and some different things. So,
I think it's going to be 2,000.
they wanted to put $2,000 in there for training, for into the Board of Health.
They've gone to a couple of, they've gone to the one down the Iowa Public Health
Yep.
one.
Went to that last year and she's going this year.
You're right. There was one in Ames, I think, last year as well. I can't remember which one that
Yeah.
one was. So there was a registration fee,
Mhm.
not so much travel.
Yeah, so.
Okay, so that's based on actual, not a long experience, but some experience on what they cost.
Yeah.
Right,
Okay.
yeah. And we wanted to make sure we had enough in there so that since there's, the 5 of them, that they'd be able to, either if there's something, do something like a large one, they could vote one person to go, or they could go to multiple smaller things for registrations and it kind of depends on what's available to them, or do some virtual trainings too. But we
Thank
haven't
you.
seen that yet. So, and then yes, on the vehicle, it would be the fiscal year 25 that we could reduce to 1,200. The re-estimation will probably be about the same from what I'm seeing so far. On office supplies, we did re-estimate about 2,000. We increased that, and then the main reason for that was just because of the office remodel taking place. There's a few things that we've have to purchase and do to kind of, like we got some doorbells so that when people are at the window, we can see it in our office since we don't have a visual line of sight, and just some different little things like that. Some brochure racks we're gonna get so that we can put them outside for the public. And we're gonna have a monitor as well that will have information for the environmental health department, but also when they come to our window, we can pull stuff up and go through it with them. So that'll be something that you'll be seeing up there. But as far as fiscal year 25, we ended up dropping that back down to what we would normally probably spend for, regular stuff for papers and mailings and stuff like that. Let's see. The next one is the septic grants. That one is the pass-through that we were just talking about with the Story County housing. So we put $45,000 in revenue, then we put $45,000 in the expense. So you'll see that. And then again, we re-estimated that expense to match the revenues for fiscal year 24. We do have a new line item that's the uniforms and equipment. While this line item is new, the stuff that was basically just in other parts of the expenses, and we just moved them in there. It made more sense as these were all field-related items, pool test kits, field supplies, not necessarily office equipment, which is where we were putting a lot of that before. So we just kind of wanted to break out better what we're using for our inspections and our programs versus what we're using in our office. So that's kind of what that line item is. For legal notices, we kind of left that the same as what we estimated. We dropped down the re-estimation for fiscal year 24 just to 700, and then we kept the projected fiscal year 25 at 750 in case we have something come up. We will probably, I don't know if we'll see it in fiscal year 24, or I mean, fiscal year 25, but there's a lot of different administrative code changes happening to all the DNR stuff. And we will probably have to update our ordinances. I'm just not sure to what degree and how it's going to be done. So I may end up coming back to you and having to talk about that for an amendment. So regarding postage and mailing, we kept that pretty much the same as what we've been doing in the past. We are doing more with our septic maintenance contracts, sending reminders. We have a different process in place now. We are anticipating doing some mailings for grants to counties, so that we'll have some mailings that way. And then, of course, our enforcement mailings that have to go out every now and then. And then reports, and our kind of our biggest expense in that area is our shipping labels that we, for all of our water samples. So so that will be about the same as what we've done in the past, not
So
changing.
you're sending reminders to homeowners?
For the septic maintenance contracts. So that is, so like on the ones that have like a peat or a cocoa
Oh,
filter,
okay.
they are required by law to have a maintenance contract in place for the life of the system. And so generally they send them, or the contractor sends them to us. What we do is we go through our list, and if we don't have an up-to-date one, then we send out reminder notices saying, hey, we don't have it. And then if that doesn't happen, we actually send out notice of violations, and we can do enforcement for not complying with the state law.
Thank you.
Let's see, so employee mileage and expenses, that stayed the same. We've kind of kept it at that price for, I think it's just been at that mark for the last couple of years, stayed that way, and I'm not anticipating any changes to that. Let's see.
Have you utilized?
It gets you to, I think right now, we've had some mileage reimbursement for staff having to drive to like meetings or conferences when if something wasn't available, or there's been a couple times where I know Laura's had to go out and do some water samples and there wasn't a vehicle available. I think it was, our Tahoe was broken down at the time, so it was like needed a tire.
Okay,
So yeah, it hasn't been very much. I want to say we're probably in the 150 range.
okay,
So.
okay.
For your education and training, though, they're coding that to education and training for mileage, correct?
If she's not, I do.
Yeah.
Okay, I'm just making sure, just
Yeah.
because we like to have all
Yeah, No, you're right. Yeah, I think we
Okay.
have changed that a couple times.
No,
think
I just want to make sure that none of that's coming out of the.
Yeah, I'm like, I think I have gotten an email on that before. So so yeah, let's see, the communication services, there is an increase in this line item. We, like our communication costs, for, devices, we're going to get, and we're looking into whether we're going to do tablets or phones, for the staff to use in the field. So a lot of our GPS location, we have to use a phone, and we've been or a phone or a tablet, something with Wi-Fi, and we carry our personal phone and we make a hotspot, and then we connect this other phone to it. A lot of times we have trouble getting it to connect and get accuracy, and kind of talking to other departments on how they've handled it. A lot of them have started either using phones or tablets for that kind of stuff. So that way staff doesn't have to use their own personal phones. Nobody is currently being reimbursed for using their personal phones. So I thought this would be a cleaner method for the county if we just had devices that they could use. And I'm just doing a cost evaluation to see if a phone or a tablet, and working with IT on that too, to see what would be the best thing to use. But that I kind of anticipated based on what the phone cost for my phone is every year, what two more would end up being. That's how I came up with that 1,500.
So I don't know if this is a good time to talk about it or not, but let's talk about the software situation.
Okay,
and what your status is, because it's in the IT budget for next year.
yes.
But I think when we met with IT, we kind of made a note saying, let's find out from health what they're leaning toward, what they're thinking, what they're wanting to do.
Yes, we're still, we would definitely, the plan is to move to that new software in fiscal year 25.
Okay,
And that will, so this would be more for our GPS stuff, which that is more for our software, which is our permits and our tracking, all of that stuff. But we would still be able to, like, these devices will be, because what I want to see in that software is more inspection capabilities. So not only will it do permitting, but it'll do our field collection data too. And so these devices would be able to pair with that nicely too, so that once that database is in place, we'll have access to all of our permits, but we'll also be able to do our inspections right there in the field on that device.
So the IT budget just has the software, not the devices.
Right.
Okay.
Yep, the devices are
And
here.
they can be used for both purposes. Good deal. So what have you heard about the state's plans?
Well, I know as far as like septics and wells, that is a DNR division, so that is not being affected by the realignment. So we'll continue to do all that stuff. Our inspections, tanning is, so tanning, tattoo and pools, they moved from HHS to Dial. We have not heard any real, we don't have any real idea of what's going to happen yet. We have been told that Dial anticipates to keep the contracts with us. We have not been told any differently, so we assume that pools, tanning and tattoo would still remain in our department and at the county level.
Dial is inspections and appeals.
Yep, Department of Inspections, Appeals and Licensing now, I think.
Ah,
I'm trying to, I was like, what is their new? But the software that you're talking about, we have two of them in our department. We have the PIP, which is what we're looking at replacing. And then there's a standalone program that does our, the tattoo and tanning. We did not include any of that in development and stuff because we're not sure if if Dial is going to come up with software or if we're going to still have that contract. So that's why when we did the CIP, the price didn't change because we're like originally we had talked about doing all of it. And now we've kind of been like, well, we're going to hold until we know if we're actually going to have those programs. We won't have to worry about, we won't do that in the new software. But PIP was basically always just the septics and wells and complaints.
so the realignment is moving things at a state level, not trying to incorporate what are now local programs, not trying to scoop them up to the state.
Yeah, so
Is that what you're hearing?
no, they want to, there's there's 4 different options. There was a report that came out that we had been waiting for, that was supposed to be out in October. It finally just came out the Friday at 8 p.m. before the legislative session started. So that gave us, there's supposedly 4 recommendations that this HMA gave to HHS that they thought would be good options. And like,
Keep as is.
Yeah.
That's not going to happen.
yeah, the last option is keep basically as is. They don't want that. The first option, which we can assume they want, that's basically everything. Local boards of health are gone. They end up for like programs that are not part of a public health agency, which is what we are. We're kind of in this like limbo state as far as what we do, like some of the public health programs, like with Mary Greeley and stuff, would move to a regionalized system is what it sounds like. And I think they're considered more state employees on that option. Then there's another one where they're not considered state employees. They're like regional and the counties all contribute people to them and things like that. But I can send that, if you haven't seen that report, I can definitely
Could
pass
you
that
do
on to
that?
you.
I'd like to see it.
Because it's, yeah, I'll do that. And then there's like the public health section, they have an environmental health section. But it really, with the change in HHS, with them moving pools, tanning and tattoo out. And all of our other stuff is DNR with wells and stuff. The only thing that we actually have left with HHS is grants to counties, which is our water sampling program, grants to counties. And that's our water samples, well pluggings and stuff like that. That's the only program that we will still have with HHS that we're working with. The other one that got kept was childhood lead, which my department doesn't do. I'm assuming public health
I
probably.
think public health
Yeah,
does.
they do that, but those are the only two programs, like from an environmental standpoint, that were left in HHS that we'll deal with.
So you said there were 3 options or 4 options in the study.
They call them, it's option A, option B1, B2, and then option C.
D.
And C is kind of, it remains as is, which
We know that's not gonna
it's not
happen.
gonna happen. It's really what will, in my opinion, it's whatever they can get pushed through the legislative session this year. If they can, there's a lot of things that would have to change, but if they can get rid of boards of health, local boards of health, if they can make that happen, that will either lead us with option A or option B1. And those are that's kind of what we're gonna have to see happens.
So what was B2?
B2 was, trying to remember, it was a regionalized option 2, but the counties could retain their local boards of health. And then, yeah, it was something about, but the counties had the ability to retain local boards of health in that one. So B2 and C are the only ones where local boards of health get to stay. So there's a lot of stuff there, and there's a lot
So
of,
there's potential heading when implementation is for that,
yes,
things will change, could change in your budget. If there's no local board of health, then you're not gonna have training
right,
still in there, but
exactly.
you don't know right now because we have no idea what plan.
So if
That would
there's
be-
no local boards of health, but environmental health is not scooped into a region?
It doesn't, it sounds like grants to counties would be scooped into the region, but not us, because we're not part of a public health agency. And we haven't gotten clarification on that, but that's what I've heard from other agencies that are similar to me, is that, well, there's some agencies that would just get rid of environmental health altogether and not do those programs, or or they'll move them under a different department within the county agency. I'm gonna say most of the ones that have like a pretty strong support are looking to, if they don't go into a regional option, that they'll end up getting moved under a county.
So how does that relate back to the 125,000 for software development?
So as long as, I mean, I guess, as long as you guys want to keep environmental health in the county, then, as far as like, because that is pretty much what would happen for wells and septics, you would have to have somebody doing those programs, because those won't go into the regionalization, that part. But as long as you had that, then those programs will not change, and that data, that software is what's going to do our wells, septics, and complaints within all of our parceled data within our county. So it would still be usable. It'll still be everything that would be needed and things like that. That's why we did not include the pools and tattoos, because just wasn't sure if the state's going to come up with their own program, or if they're going to end up having state employees do those programs.
Oh,
Yeah, lots of changes and I don't have good answers for you
yeah.
and stuff. And unfortunately,
They'd be planning towards July 1 and not knowing where they're going and what
Yeah.
direction with these. Is
I
kind
mean,
of-
from what I see is, I mean, from our department, we would end up being like, we would stay probably within the county. That would be what would probably be best, is to just be moved under.
But
however.
you would not have the functions anymore on tanning, tattoos and pools? Because those would.
We
be-
would, it depends on how they do that. They may still contract with
Okay,
areas.
Yeah,
Because
they're
it's a
not-
contract
Got
with,
it.
so HHS doesn't have, it's Dial that has that contract. So Dial, they would just, instead of contracting with the local Board of Health, which is what they do now, is Story County Board of Health, they will end up like contracting with Story County.
got
And
it.
so it would be a contract amendment,
Okay.
so.
So Board of Health is likely to go away.
I think there's
Potential
strong
for it.
potential.
Strong.
Yeah, I think
Would there be one at the regional level then?
I don't know, they got rid of the state one. They basically said no more to the state Board of Health. So,
We just don't need boards of health.
yeah, it's,
What do they do anyway?
yeah, right. So I don't know. I'm not sure how they'll do it, but,
It'll be interesting. That's
and
a
I,
good summary. Thank you for doing that.
yeah, no problem. And I know that, like, I mean, I'm with the Iowa Environmental Health Association. I'll end up transitioning to president of that association in March. And we've been working on this. We've had meetings with Dr. Cruz and HHS, and we have not gotten a very good response.
Haven't
And
felt very listened to, have you?
not at all. So,
Well, they know what they're gonna do.
yeah, and that's kind of the consensus is they know what they want to do. They're just going to see what they can, yeah, what they can get done.
So long story short, the software will still be useful and we would not be programming for anything that we will not need.
Right. It will, the data,
Won't be doing.
the new software would be, everything we'd still be doing is going to, no matter what changes that way, it would still be functional and useful and stuff like that. No problem. And then let's see, education and training was our next one, I think. So there is a slight increase in this from the previous year. We had estimated 5,100, it's about 5,300 this year. They had been doing a lot of our conferences in the Des Moines and Ames area. And now that COVID and all that's over, contracts are getting changed and they're moving things back to where we move around again. So one of our conferences, the IEHA conference, it's going to be in Waterloo. That one is one that all three of us typically go to. So that we saw a bigger increase there. The other thing is that there's a GIS conference in San Diego. Matt's gone in the past and he requested to go. Again, there's some new stuff that he wanted to learn how to do with our GPS equipment and our field stuff with ArcGIS. The registration is covered through, I believe, through the GIS department. They like our licensing, we get a free registration. So it was basically the cost of airfare and hotel and food is where we came up with that. And so we did put that in. I usually have in there to go to our National Association conference. I am going to go this year. It's in Pittsburgh, but like last year and this year, being with IEHA, being the president, they pay for that. So I removed that amount from the budget. So I figured it would be a good time for someone else on the staff to be able to do something as well. And then we'll probably try to rotate like a national conference and stuff with the other staff, especially once Laura gets certified with her credentials. I'd like to see her be able to go to that sometimes as well. But let's see, as far as well permits, this is a $25 fee that we pay to DNR. We collect that with the applications that we get. So we have the drillers pay for that fee when they apply, and then we just I think twice a year, we cut a check and send it to them, and it's just based on the number of well permits we issue. So we estimated about, I think in 24, we estimated, or we had budgeted 500, we're re-estimating 400, and I'm kind of, if we're looking at the 15 wells that we typically get, it'd be about 375. Let's see, groundwater protection fund, that's our grants to counties well rehab program. And like I said, we get the 50,500. And the way it's been broken up before is that this line item is 75% of that $50,500. And that's for some of the tangible program expenses that you would see related directly to that. And then some of the other stuff like administrative fees, like postage and things like that, that's been included in other parts of the budget elsewhere. So that's why it doesn't match the 50,500. And then we did re-estimate that it would, for 24, that we'd be looking at about 30,000. And then, which is more than what we've done in the past, so that's good. So that's kind of what we're looking at there. And then as far as equipment, rental and maintenance, we have the increase, and that is because we were able to decrease our cost for our data plan for the GNS receivers. We went to a different way of paying. And then we do it like an on-demand, because we can share it. We have 2 devices now, so we can share it between the 2. And so before we just had an annual plan, but it could only be used on 1 device. And then this allows us to track how much we're actually in the field using it. And then, but we ended up getting, it's called Septic Pro, and what it is it's for soil evaluation reports and as-built drawings. We wanted an easier way to provide the diagrams for the septic systems. And this software allows us to do that. It's a subscription. It's the $1,200 is like for a year. And so we're hoping, it seems to be working. We're in the process of getting it customized to to Iowa and to our county. And so we're doing that. And then it looks like it's going to work out pretty well. So that would be an ongoing expense. But if we find out that it's not going to work as well as we thought, then it is something that we could remove in the future. But I'm hoping with what it can do for the as-built, it's supposed to be making our diagrams a lot easier. Currently, we have to go into a couple different systems and do it, and it's pretty time consuming. Matt's pretty quick at it because he's done it a lot longer, but like for Laura or for me, it does take quite a bit longer to do those drawings, and this is a lot more accurate. It'll actually have like different systems in there, and it plugs in the drawings of everything. So it was pretty, it was, for the price, it was very nice to see that, because they're usually pretty expensive.
I'm just remembering the hand drawing that you provided me for our septic.
Yes, yes,
Thinking, you're
Yeah.
way past that now. I
way past that.
It
And
was very, yeah, showed the surveyor, it was very iffy.
yeah, and you know, it's really, some of those drawings are really nice, but if you saw mine,
Well,
they are
Don
not
did-
that good.
And do
Don
you
did
have,
good drawings?
you
but-
don't have any concerns about it? Is it gonna need to communicate with the PIP software?
Nope,
that
it's a standalone. What it does is we end up doing it, and then we can share like email or whatever, or share with like installers, but we can it'll create a PDF report, and that PDF is what will get saved in our database like we do now. So now we just scan everything, or we
Mm.
create a PDF and put it in. So. And then dues and membership, just a slight increase from the year before. And that is because of just, we had a couple renewals. They renew like every other year, every 3rd year, and some of them are due now. So that's why we're seeing that increase. Lab services, there's also a slight increase there. And that's mostly just because of increases in lab costs that the labs have been sending us like, hey, we're raising our price for this and we're doing that. So that's why we're seeing some of that slight increase there. Office equipment and furniture, don't have any, we're getting most of that out of this year. So I don't think we'll have anything in fiscal year 25 that we should need. So any questions on the expenses?
Anyone else? Okay, do you want to check then about the position?
So. Well, I submitted the letter. I'm assuming you guys all had a kind of chance to review that over. I just wanted to kind of, I didn't know if you had any questions specifically about that before I kind of go into some of the, I think, the more reasoning, like more tangible reasoning that might help you that way, but I can kind of go into that, and then you guys have
I
to-
prefer that, yeah. that's
Okay.
good.
Let's do that. So I think our primary reason for wanting this, I mean, I will say that she's, I kind of based on the first 21 weeks, we've been a little over that since we filled this out. And we've been averaging about 28 hours a week. She was supposed to do 24, is kind of what we were assigned to, but we've had to flex here and there because of schedules and different things like that. We do always try, like, after talking to Alyssa, we try never to go over 30 hours because of the insurance stuff. I know that we can do it a certain amount of times a year. But we've done that, I think, 5 times, which 2 of them were because we didn't know holiday pay factored into those hours. So once we learned that, we've flexed things differently in the future. But there has been a couple of times that she's had to do more than 30, and that has been because, and that was scheduled mostly because of if I was at a conference or if people were on vacation. We had the sewage conference for 2 days, all 3 of us were out, things like that. So just the way things work, we've had, we've had need for that to move around. So we have seen quite a bit of need for her to be there and help facilitate different things and be there. But the primary reason is just to improve our customer service for the public and our installers, just having someone present to take like all day long to be able to take the payments, schedule inspections for us when we're out in the field, answer questions, navigate the website, or just assist with applications that are coming in. That would be really nice. I mean, I know we shared the position in the past and duties were split. So, but we always had that full-time coverage. And now that we've split and we're seeing that, there is times where we don't have her there like in the morning or afternoon or one day a week that she doesn't come in. And even though we've been flexing it to meet our needs, it's not always the easiest for scheduling too, because we'll have to be like, oh yeah, you can, talk to Ally on this and she'll help you with this. And then we kind of have to look at the calendar and see when she's going to be there. And it would just be I mean, that's kind of the one thing I've heard from some of our installers is, I wanted to make a payment, but I called and, nobody was there, or we weren't able to do this, or they call and they talk to like me or Matt or Laura and, where Ally normally handles it, we have to stumble through it a lot more, and where she's like, oh yeah, here, go do this. And it's a lot easier for them. So that's kind of our, just having that public's access to assistance is something that we'd like to see. Just also ease of scheduling for us. I mean, like I talked about, we've had to move our schedule around quite a bit here and there to just meet needs and for scheduling different things that can be kind of a challenge. But having a normal quote unquote schedule, I think like her normal 9 to 3 schedule, I think we've maybe had 3 weeks where we've actually had that. All the other times we've had to adjust somewhere along the lines. And it's great that she's flexible and can do that. But, I don't want to take advantage of that too much either too. So the other thing is just, I mean, relieving staff of some of the admin work that they can do so they can focus on their primary duties, develop programs, increase their field time capabilities. Just since Ally has came on and we've had a person in that position actually learning stuff and doing stuff, we have seen our grants to county numbers pretty much like, so if we compare Q2 of this year to Q2 of last year, we've doubled what we've been able to do because Laura has been able to, and Matt have been able to get out there and do more water samples. For every sample that you take, it's about an hour of admin work overall that comes in because you have to, there's the mailing, getting all the labels, the chain of custody and all that stuff filled out, putting it in our system. And then when those results come back, mailing things out and enter it into the state database. Those are all things that now Ally is able to do. So Laura has been able to get out there and do way more promotional activities. And then Matt and Laura have both been able to go out and do samples that they weren't able to do as much before. We also saw with our Radon promotional month, we do that every January. We had, I think last year we gave 32 kits away and almost all of them went to county employees with a few residents. This year, we hit our max. We always try to say we'll give out 50. We gave away all 50, I think by the 3rd week in January. They all went to, there was, I don't think any employees that came in this time. It was all county residents. We also sold quite a few that came in addition to that, because we were able to do a lot more promotional activities and then just having someone there to be accessible. There was only a couple times we actually had to ask planning, like, hey, someone's coming in for a kit. Can we leave these with you? And then they have to, collect the money or do our tracking form, things like that. We also created a tracking mechanism this year for seeing who took them And so that we can do follow-up to see if they're testing and what those results are. That's something we've always wanted to do and not been able to implement in the past, and we do have that this year. Maintenance contracts for our septics that we were talking about, she's handling a lot of those mailings now. That's quite a bit of time, I would say. Probably about 10 hours a month, maybe, that can be involved in that program of tracking everything and mailing it and stuff like that. You know, some months more, so I say that 10, that's probably the busiest of the months when we see them, probably the first part of the year. And then, you know, but it is something that she's able to do now so that Laura and Matt can focus on the following up on the enforcement, which really that fell through the cracks in the past. And then, you know, I guess the things that we're kind of looking at is there's a lot of more field work that can be done. There's research that can be done. There's a few studies that we would love to participate in as far as, you know, with the groundwater. There's, you know, some like looking at the chloride or rock salt that's getting into our aquifers. They're looking at that at surface water, but we would be able to start incorporating that into our private wells. We're also looking at, some working with the DNR on testing wells for neonicotinoids, which is a carcinogen, and PFAS and stuff too. And those are all things that we would like to get involved in. We just don't have that time to do it. So, and then just, you know, just when like the applications for the septic grant income verification, those are things that she'd be able to help out with if we had someone there full time doing that. And like I said, we're already utilizing her close to the 3/4 time if we could. But yeah, I mean, so going to the full time, we could definitely find more work for her. There's definitely enough to do. And I kind of brought Ally in. She's been assisting me with the budget, in general budget activity. So I wanted to see how this all went today, but also if you guys had specific questions on things she's been doing, she's here to answer.
I think you've given a very good summary of the things that you've been able to do with the position, and I appreciate that. But we also are going to have to look at the fact, quite frankly, that this is not a real good year because of House File 718 and the property tax limitations we have. It would be as I'm looking at this, a $50,000 increase, and that would not just be a one-time cost, that'd be ongoing. So I don't think we're going to be able to say today whether or not we can consider that. We're trying to look at status quo budgets as much as possible this year.
Definitely understand. And if
Need to
there's
tell you that.
anything that we can do to provide, you know, more information, that was kind of part of it too, is seeing if there's, you know, anything else that we could assist, telling you what we, you know, what we could do.
I think it just comes down to what we can afford. I
Okay.
don't know if more information, you've given a lot and I appreciate it. And yeah, and I also realized that, you know, before the two offices separated, we had one full-time administrative assistant. So we did a 50% increase in that time, and this would be, you know, making it 100% increase. And that's that. I'm sure that planning and development is willing to help you out at times that you don't have somebody there. And I know that doesn't give you the specialization that having Ally and being able to do all that does, but just in terms of general office coverage, I'd talk with Leanne about that to see what more they might be able to do.
Yeah, I mean, I completely understand that. I know, I think it comes down to like, you know, the ability for, you know, retention, and also just when we did have the vacant position, it was really hard to fill. It took us quite a while.
Yeah.
So,
And
but
I
I
thought
do
about,
appreciate the
I
consideration.
understand that as well. You know, we're having, you know, retention is an issue throughout employment these days. So we'll consider it, but don't, realize it's going to be a tough one.
Yep, I understand. Thank you very much.
Thank you.
And I do appreciate that you kept your operating budget reasonable. You didn't have much increase there, and you explained the increases that are there, and I appreciate that.
Yep, thank you. Guys, have a good one.
Thank you.